We're going to dig into a different data set, and that is the data set that CBC Investigates put out yesterday, dealing with universities and their recording or lack thereof of suicides. And we're going to talk to Dr. Janine Hubbard to get her reaction when we come back. Nothing says the May 2-4 long weekend in Newfoundland and Labrador like Big Stick Bologna. Oh, my goodness, that was a great commercial. And as we're going into mental health, you have to laugh sometimes and put on a smile, and that's why I mentioned that, not to take away from this serious subject. But glad to have with me Dr. Janine Hubbard. Janine's no stranger to the VOCM airwaves or any of the other airwaves in Newfoundland. She's fantastic at simplifying for us lay people a lot of the data and information that's out there about different trends in psychiatry and psychology. How are you doing today, Janine?
Oh, I was just talking to Claudette and saying, best kind. We're heading into a long weekend. No, I'm not camping. But looking forward to a little bit of downtime.
Well, I think, yeah, and for all our selves, best selves, we should do that. Not necessarily best selves in terms of best practices. No. So I sent you the story yesterday that CBC Investigates did, and credit to them, where suicide leading cause of death in people, young people, but most universities don't track it. Just to remind people, CBC found that over 70% of universities don't track suicides. Before we get into the why they don't and some of the challenges there, Janine, as a professional in this area, why is getting a rich data set about something as difficult and painful as suicide important?
Well, partly, and thank you for even, I guess, 2 days in a row now having this on as a topic, because this is one of these areas where the more we talk about it, the more we are open about it, it decreases the stigma, it increases the likelihood of people reaching out for help. So, again, just a really important discussion to continue to have and to be really frank and open.
Well, you're welcome on that, and it is Mental Health Month, but I think we should, whether it's May or not, always talk about it. So thank you for saying that. But tell us about why more data matters here.
Well, it's interesting because on one hand, listen, we know suicide is the second leading cause of death in youth ages 15 to 24. So we know that that's an age group that is vulnerable. The more we can understand about potential risk factors, I mean, we know a lot of them in this area, but in particular, if there are perhaps specific additional triggers that occur in the post-secondary group. I mean, there's some I can think of right off the top of my head. It's often the first time away from home. It's a change in social structure. It's for many first exposure to things like substance use, drugs and alcohol. It's high stress. There's a lot of pressure. There's a lot of financial pressures. So there are a lot of additional, I guess you could say, potential risk factors, not just in the youth population, but specific to post-secondary students.
And how do you go about tracking it, given your practice in large measure is guided by protecting the privacy of the people who come and seek your help? Universities
I'll be honest, I'm not surprised. Sorry, I was going to say, because in many ways, that's an almost impossible task to ask of universities. A couple of reasons. Because, I mean, things are tracked by police, by hospitals, by coroners, and there's that piece, but there's many cases where you might hear rumors or rumblings, but if the family does not disclose a cause of death, you're not going to hear about it included in those stats. This is also a group where you don't know what might be accidental versus intentional. As I was mentioning, a lot of substance use, a lot of, potentially risky behaviors, first time away from home. So just being able to have an accurate data set is almost impossible from a university perspective. And you're quite right. I mean, when we look at mental health services, those on campus, you could track things like preventing issue that also can get a little tangly in terms of data collection, because depending on how small or large a campus it is, that can cause difficulty. But you also don't know how many people are out there not seeking services, not able to access services, maybe accessing private services or elsewhere in the healthcare. Just from a research design perspective or a data collection perspective, it's almost impossible to get accurate information.
And what do you know, or what have you seen in the research, or just anecdotally, when somebody is a victim of suicide? How often have you found, or have you seen research that reflects people's willingness to talk about that? Is it 50%, 20%? Do we have any idea of how often people who have lost a loved one to suicide share the story of their death?
I think it really depends on the family. It often depends on, is this an individual who perhaps has had long-standing issues with mental health, and we do know that the number one predictor of death by suicide is a prior suicide attempt. So again, depending on how public or not public that may have been, that makes a big difference. I have increasingly seen things like in obituaries, lost their battle with depression. In terms of, or again, with a long-standing mental illness, but also in some cases being more willing and open as a way of healing, as a way of saying, please send your donations to, a variety of mental health associations, as kind of a way of giving back or acknowledging or trying to prevent it from future. But it, unfortunately, in our society, in some ways, like I say, there's still a stigma, and this is also a group where, as I sort of said, unless there's very clear either history or intention or, notes or whatever it may be, you often don't know for sure.
That's the tough part. All right, before I let you go, two questions around the same sort of thing. Do you have an issue with the fact, or find it problematic, that Memorial, as reported by the CBC, stopped collecting this data in 2019, or based on what you've just described, it would be difficult to get accurate data?
It would be very difficult to get accurate data, and I can appreciate that during the pandemic, where, again, you had students off at distance around the world, how you would have any semblance of methodology there. Like I say, I think something that's far more useful is tracking things like the number of requests for counseling services, the number of and types of services that are being requested by students is probably more useful data set.
Yeah, and that was where my next question is going. So if we can't track the data for all the reasons we've just discussed, that is the approach you would recommend universities take to glean as much other information about how many people are seeking counseling, what you know related to that, as a way of planning your university's investment in managing this?
Oh, for sure. And I think that there is value in continuing to look at, even if it's student surveys, of just how are you doing? How is your mental health? What are the things that are contributing to your stress levels? Because we've seen that really shift over the years. We've seen, again, that increased pressure in terms of getting a degree, getting out to employment, trying to find housing, the cost of university or post-secondary programming. I mean, I was very privileged and very lucky to come up in a generation and from a family that supported the, sure, go get your liberal arts degree and eventually figure out what you're going to go do. That is just so not a reality for so many of our young people anymore. And so better understanding the pressures, better understanding what is needed in terms of mental health supports and how we can help them better cope.
Well said. And again, a reminder, as Janine and I would want you to know, if you are feeling that you need help after hearing this, that we certainly have the National Suicide Prevention Line, the Kids Helpline. There are places to go and people to call. Thank you, Janine, for your time today.
Thank you. And if I can just say, and if you're worried about a loved one in your life, please don't be afraid to reach out and approach the topic with them. Because equally important, people are really scared to do it. Thank you for covering this, Tim. Really appreciate it.
All right. Thank you, Janine. You have a good weekend. That's Dr. Janine.